Every year we celebrate World Health Day around this time, and this year the theme of World Health Day is depression. Let's talk. And I will think that let's talk is brought up as an annex just saying depression, because it's something that we kind of don't talk about. It's something we kind of use it to, I'm so depressed, but it's a whole lot more than that. It's a whole gamut of symptoms, especially symptoms that last over 2 weeks. There's a way to look at depression.
While there is so many things to be said and can be said about depression, there are some basic facts that we would like to remind people of. And for me, important is reminding people what the risk factors are. 1
in 4 people are going to have depression over the lifetime of different. You can have simple depression that you can actually relate something to it, what might get you to that state if you have problems with your finances, as most of us tend to do, or I don't have a home, I'm having challenges with my child, my mother died, whatever it is. You can get to that state, that emotional state. And there are people who are depressed and for no reason. Why? Because they've had family history of depression, other people in their family who have that's the genetics of it. Other people who have had similar problems, or it may be depression within a bigger mental health problem, or they may be on medications that can actually cause you to feel depressed, like blood pressure medications, contraceptives. People with severe illnesses tend to have depression as one of their clinical symptoms.
Even the pausing of the menses, or menopause in ladies, or andropause in men, and that leads to some form of depression later on in their life. So I call those risk factors. Traumatic events can also be a serious risk factor. We've had our own Ivan here and the depression that followed thereafter.
So Grenada is not different to anywhere else in the world for how we express having depression. How do we cope with it? Girls talk sometimes to their friends. Girls talk. A few of us, I guess, people understand a little more, and we probably go to look for the doctor and say something is I'm not feeling too good. Or we go to church and we pray about it. Or men drink or use substances, unfortunately. I'm not saying that girls don't use substances, but I'm saying that our men will drink, okay? And that's one of the manifestations. That's how they cope with their depression. Often people need some support, some psychological support. Talk therapy. Girls do that, like I tell you, they go and talk to their friends. Unfortunately, because we don't really understand it very well, unfortunately, someone says, get off yourself, come on. Get together, right? But sometimes a little more than that, because people sometimes do need medications. Often, you might need medications for several months, like up to 6 months.
The issue of stigma and discrimination, and when I say stigma and discrimination, I mean stigma for even people who are diagnosed as having depression. Somehow our population is not keen to accept the diagnosis of depression. So much so that it makes the treatment even harder, because if people are not going to accept that they are depressed, then the treatment is not going to work. Stigma and discrimination, again, can go across different social groups, subgroups. We have people in our community that suffer because of stigma and discrimination.
It's probably a good thing to see a physician if you're really not feeling very well. But it's also a very good thing to talk to the psychiatrist. That's his specialty, his or her specialty. We still have our challenges, but we do have the services. I wish people wouldn't think of Mount Gay as a bad place. Mount Gay was erected because there's a need. And as much as you have diabetes and hypertension, we also have depression and other, more severe mental illnesses.
So while I'm happy with the fact that we're now able to discuss depression on a global level, to my mind, the issue is far deeper, more cross-cutting, and a more continued, sustained discussion must happen if we as a nation, as a people, really want to deal with depression. And we must not just talk about it in one sense, but right across the social strata.